Management of diabetic eye disease. Diabetic eye disease is a group of eye problems that can affect people with diabetes, which include diabetic retinopathy, diabetic macular edema, cataracts, and glaucoma. Diabetic retinopathy is the most common cause of vision loss in diabetics. In India, prevalence of diabetes is 8.37%, of which 18% of the affected individuals are likely to develop diabetic retinopathy. Managing diabetic eye disease involves maintaining hemoglobin A1C levels, blood pressure and cholesterol in a healthy ranges, quitting smoking, regular eye exams, at least once a year. Advanced eye problems are treated with laser treatments, medicine, surgery, or a combination of these options. During laser treatment, the leaks from abnormal blood vessels are treated with laser burns, which stops or slows the leakage of blood or fluid in the eye. Laser treatment is one of the prototypical approaches for the treatment of diabetic retinopathy and focal and diffusive macular edema. Laser treatment can diminish the 5-year blindness risk by 90% for proliferative diabetic retinopathy and by 50% for macular edema. Different types and techniques of laser treatment used for the treatment for diabetic retinopathy are listed here. Vascular endothelial growth factor is a glycoprotein, which plays a central role in the progression of diabetic macular edema. Its levels are elevated in the vitreous of patients suffering from macular edema. VEGF increases vascular permeability and neovascularization through multiple mechanisms. Some of the antivascular endothelial growth factor drugs recently used in the treatment of diabetic retinopathy are discussed here. Ranibizumab binds to vascular endothelial growth factor receptor binding site and leads to reduction in the vascular leakage and formation of new blood vessels. Bevacizumab decreases the neovascularization of cornea, may inhibit infiltration of macrophages. Pegaptinib acts on vascular endothelial growth factor 164 isomer, and results in the inhibition of neovascularization and decreased vascular permeation. Aflibercept has high affinity to vascular endothelial growth factor A, and is the only drug that targets placental growth factor 2, and upon binding to these factors, vascular endothelial growth factor activity is reduced that subsequently decreases vascular permeability and angiogenesis. Cryotherapy employs freezing temperatures to cause cell death by necrosis and ischemia by formation of ice in smaller blood vessels and surrounding extracellular fluid. The traditional cryotherapy treatment is performed under anesthesia, where each session consists of 36 applications of cryotherapy. Complications include overfreezing, underfreezing, freezing of the non-target tissue, cracking of the adhered tissue while detaching the probe. Steroids have anti-inflammatory action, alters the composition of endothelial basal membrane, which limit permeability and leakage. They also have a neuroprotective effect on the retina. Steroid-related side effects include increase in the intraocular pressure and cataract. Some common steroids used for the treatment of diabetic retinopathy include dexamethasone, fluocinolone, intravitreal triamcinolone. In islet cell transplantation, the islets from the donor pancreas are transplanted into patients with diabetes. Studies have shown that this method has benefits such as islet isolation, immunosuppression free of glucocorticoid, and the provision of islet mass more than 10,000 islet equivalent per kilogram of individual's body weight. This also includes the long-term secretion of C-peptide, reduction of hyperglycemic events, improved hemoglobin A1C values, and reduction in progression of retinopathy. Clinical trials are currently under investigation to expand treatment. Vitrectomy surgery involves making a tiny incision in the eye to remove blood from the vitreous as well as scar tissue that's tugging on the retina. A study reported that 88.71% patients who underwent vitrectomy surgery had stable anatomical results. On repeated surgical interventions, 92.65% of these patients had successful anatomical result, and 7.34% had complications. Diabetic eye diseases can be successfully treated, thereby preventing severe vision loss and improving visual acuity. Owing to advances in therapeutics, diabetics have more options for treating eye conditions. Moreover, early detection of diabetic retinopathy can reduce the risk of blindness by 95%.